In the mid-1980s, Grand Prix racer Randy Mamola made a donation to save the children, a donation generous enough to attract the attention of the charity's patron, Princess Anne. They met, and she suggested that Mamola go to Africa to see firsthand the work of the charities he was supporting.
I spent a week in Somalia, and in '88, just before the Civil War broke out. At that time, there was a program that UNICEF had started with Save the Children, and they were using motorcycles, and it's called a cold chain. And that's where you take vaccinations that have to be kept cold, and you disperse them out in villages. Well, I mean, there was a garage full of broken down motorcycles. Without expertise, they were buying the wrong things and not maintaining them.
The idea for Riders for Health was born in that garage full of broken down motorcycles. For Mamola and Riders for Health co-founders Andrea and Barry Coleman, those lifeless machines epitomized Africa's problems. Not the lack of humanitarian aid, but the lack of reliable transportation to deliver it.
You can spend all the money for vaccines, condoms, and awareness, but unless you can actually get it to the people, it's useless. And that's the problem, because the people don't have transportation to come to the villages. I mean, we're talking people that live 100 kilometers, 60 miles away from a nearest hospital. There's a lot of registered nurses that have to go to villages, and these nurses sometimes have to walk 15, 20 kilometers in a day to get there.
What good is 21st century medicine if it must be delivered on foot? How will aid ever reach all the people who need it if there is no reliable transportation, if no one can fix a vehicle when it breaks down? In a land where there are no dealerships or roadside rescue services to call on, the founders of Riders for Health identified a clear objective: the creation of self-sufficient, zero-breakdown transportation systems. Whatever the destination, the distance, the terrain, the vehicles that deliver aid must get through. "15 years later, Riders for Health has grown into a successful organization, employing hundreds of people, operating across Africa from Nigeria to Zimbabwe, and providing a range of transportation services to meet the different needs of governments, development agencies, and local communities. The most direct expression of Riders' purpose remains its work at the local level, in communities with no vehicles at all, such as Binga in Zimbabwe. Riders provides motorcycles, training and logistical support, enabling the local people to run a self-sufficient health transportation system which makes a radical difference to the quality of people's lives. The vehicles don't break down and the aid gets through. Those most at risk, pregnant women, children and the elderly, can get the care they need. The spread of AIDS and malaria can be prevented, given a reliable supply of condoms and malaria nets as well as health education. Riders has also developed a new vehicle to deliver emergency aid in extreme conditions. The multi-purpose Uhuru sidecar combination, which is fitted with a stretcher, a trailer and pump to extract water from the ground. In many cases, simple motorcycles remain the best form of transportation. Cheap, reliable and able to operate in rough terrain, impassable to four-wheeled vehicles.
It's the same tool that I use to get to where I'm at today that's helping save people's lives. Ducati is a big part of it. Ducati gives us $1 for every bike that they sell. That's right around $40,000 a year. Honda last year donated 75 motorcycles for the next 3 years with spare parts to take care of them for 5 years. And we're going to try to get Yamaha and everybody else involved in it.
The news about Riders for Health is good, but the news about Africa remains bleak. The population of the continent is falling rapidly. The average life expectancy is now less than 40 years. It can sound hopeless, but it isn't. The answers are all around us in our own lives. We have vaccinations, emergency services, health education, condoms. We have them because we also have reliable transportation to deliver them. Africa needs reliable transportation too. For the future, Riders for Health's goal is clear: to deliver healthcare to millions more people who are currently without it. We have the experience, we have the people, we have the know-how. It's a goal that we can achieve as long as we find the means to do it.